Hi, this is Dr. Tom, and today we're going to talk a little bit about your knee pain and why people deal with knee pain longer than they have to. So the first strategy that most people try when they're starting to have knee pain is rest. And then they figure out that after 2 to 3 weeks of rest, every time they return to whatever activity it was that initially irritated them, whether it's squatting, hiking, going up and down stairs, they still have knee pain with that activity. So then maybe the next thing that they'll try is a brace and maybe some anti-inflammatory medications. And while this takes the bite off it, it still is kind of under there and you can feel it at a low level with those same activities. So then maybe you try to go to your general practitioner and they might recommend that you get x-rays or that you take a different type of medication and you go through a few weeks of that still without results. And you try these different things until you're 6 to 8 weeks down the road and your knee pain has started to slowly creep into other aspects of your life. If you have kids, you can't crouch down and play with them like you had just a couple months before. If you're on like a rec league or you like to go to the gym, you can't keep up with your friends and colleagues as they either lift weights or play those sports. And slowly you start to see that knee pain creep into your daily life until maybe someone suggests to get an MRI and they're looking for like a meniscus tear. The problem with doing surgery for meniscus tears is that it's been shown to be no more effective than physical therapy for the same condition. And in fact, if done right, physical therapy can have better outcomes than surgery for meniscus tears. And maybe you've tried physical therapy in the past, so now you're on this webpage seeing if there's a different way that somebody does it. And you may have had the experience where you've been into a mill-based clinic where the physical therapist sees you for 10 minutes and then you get the same 10 to 15 exercises that everybody that's in there for knee pain gets. And that works for some of the population. That's a shotgun approach, but it might not have worked for your knee pain, and thus here you are. So in order to truly solve your knee pain for the long term, you need the right exercises at the right time. And in order to assess what the right time is, we've found at the Doctors of Physical Therapy that the best way to do that is by spending 1 hour one-on-one with each of our patients. We take everybody through the correct exercises at the correct phase of their treatment and make sure that you have all your questions answered during your treatment so that you don't leave without feeling satisfied that you have control over your knee pain and you can actually start to see how the exercises that you're going to do today are going to benefit you into the next day and the next week, and how all of that is going to tie into getting back to whatever it was you came in that you wanted to do: hiking, weightlifting, playing with your kids. So if you'd like to read more about our clinic and our approach to knee pain, go ahead and read the rest of this page, and you can click to schedule a consultation with us, or you can just click to fill out a contact form and we will be in touch to schedule an evaluation for you. That way you don't have to live with this problem any longer than you already have. We can get you back to living your life as soon as possible and doing and enjoying the things that you like to do with your friends and family without this nagging thought that your knee pain is going to just keep coming back and haunt you forever. So all you need to do is either click on our contact page, fill out a contact form, and we'll be in touch shortly, or you can call us so that you can get back to living your life today.